Welcome to Face Forward, the podcast, the series that takes you behind the scenes of the riveting world of clinical trial management. I am your host, Valerie Coveney, and I am thrilled to be your guide on this journey through the nuances of planning, executing, and navigating the clinical research landscape. Today's guest is a seasoned clinical project manager with extensive experience in managing global trials across North America, Europe, and Asia within the CRO environment. With a deep understanding of all the clinical steps leading to the success of a clinical trial, from startup to closeout, she is well-versed in regulatory requirements and adept at managing multidisciplinary teams. Our conversation will center around the main takeaways from CDISC TMF US Interchange, which took place in Arizona last October. Let's extend a warm welcome to Amélie Rivet, Associate Director of eTMF Operations at Innovaderm. Thank you for being here.
Hi, Valerie. I'm so happy to be here today. Thank you for having me.
So, Amélie, how was the conference in Scottsdale?
It was so great. For those of you who don't know this conference, so it's a yearly event that gathers all the trial master file experts from various organizations. There were some sponsors, CROs, TMF consultants. You can discuss with the vendors, also meet with some auditors, etc. So this conference is very great, whether you're well-versed in the TMF requirements or maybe you're just starting in this field. And the conference would offer presentations and panel discussion for every levels. This year, we even had the chance to hear from an FDA inspector. The event also provides so much great opportunities for networking and meeting with the TMF vendors. So if you've never been there, I highly recommend this event to every people that is interested in TMF. If you're trying to start that in your company, this is the event to attend to learn about this topic. And what to say about Arizona? Such a beautiful location, wonderful weather, and I even offered myself a trip to the Grand Canyon, which made everyone envious at the conference. So if you're in this area, look at that, and you can even plan a nice trip.
So in your opinion, what were the most trending topics?
So at the start of the conference, members of the Reference Model Steering Committee created a lot of excitement around the announcement of the upcoming version 4 of the TMF reference model, which is considered as the biggest standard in our industry and especially for TMF. I would compare, this model to a cookbook for the chef or the music score of the musician. It's kind of the recipe that we are following to make sure that our TMF are well-structured and standardized. And the last major version of this model was actually almost 10 years ago. So, when they announced that they were planning this version 4.0 for the next year, it was very well welcomed by all the attendees.
Okay, and what is so special about this new reference model?
Well, they said that it would be the first TMF digital standard and that we would aim to have all records born digital. They mentioned more connectivity between the different systems that we're using and, people on that are listening. I'm sure you know that we are using a lot of systems. So that would be very welcome. They also said that they want it to be more advanced in terms of standardization of our metadata, which again will be very helpful because it would ensure that we're able to easily transfer, the TMF between organization or between CRO and the sponsor when we want to do transfer at the end of studies. So again, it's a plus. And I think this new model will address certain needs that we have been waiting for, such as integrating and standardizing the investigator site file as part of the TMF. And what about the EU CTR, where we've been waiting to better understand where we should file all these new records that we receive from our submission in Europe? So I hope that this model will be addressing this as well.
And who can contribute to this initiative?
So there was a call for volunteers. So if you're interested, you can go on the CDISC website and you can register as a volunteer. There will be meeting that you can attend and give your opinion. So there is expectation that there will be some involvement in the TMF community. People can also submit their ideas through a portal. And already, during the conference, people were already suggesting a few things, such as maybe adding a Zone 12 to our TMF to file all our records of our system. There was another suggestion that I thought would be great, is to have a program level in our model that would be above the study level. So if you're well-versed in TMF, you know that we have currently 3 levels: study, country, and site. And having a program level would allow us to file our records that are applicable to several studies. And also, one last thing that I can think of that would be very interesting is that some people suggested that we could add a certain risk level to each of our artifacts. So again, we need to stay tuned and wait for this new version to come out.
Definitely. So earlier you mentioned there was an FDA inspector at the conference. Do you have any insightful tips for future inspections?
Yes, Valerie. Actually, I was impressed to learn during that presentation that over 400 sponsor inspections, including the CRO's inspection, were conducted over the last 6 years by the FDA. So they were very busy in the last 6 years. But yeah, that was a really interesting presentation by this FDA inspector. But maybe I can share with our listener 3 of my take-home messages from this presentation. So first of all, the inspector insisted on presenting reliable data. And in terms of eTMF, how we can do that is by using a validated system to store all our data. So this is where it's important that you use a system that from a qualified vendor, and you need to make sure that your system has been validated internally. Also, he mentioned that more and more inspectors will request access to the TMF when they start their inspection. So as a CRO or a sponsor, you need to be ready with your proper access rights that you will provide to this inspector. So make sure you have a little training ready, a brief training on your system, because again, they will be expecting to receive that before being granted access. And finally, my third point is that we are hearing more and more about evidence of sponsor oversight. So if you're a sponsor and you are delegating the task of TMF responsibility to your CRO, then the inspector might be looking for some sort of evidence that you've been overseeing what your CRO has been doing.
Okay. And on to our last point for today's episode. What would be, in your opinion, the future of TMF?
Well, the first thing that comes to my mind is this whole risk-based approach that we hear everywhere in our industry right now. And the TMF is not spared. Unfortunately, I think also managing the TMF using this risk-based approach is, unfortunately, it's not a one-fit-all approach. And each organization must determine their own process to do that. And keep in mind that it's not just expected for your quality control of your documents. So this risk-based approach should be considered for all steps of TMF management. It can be applied to your inspection readiness reviews, your audit trail reviews, the way you validate your system, the way you verify your users every month or quarterly. So think about it for every step and see if you can focus on certain more riskier areas. So the future of TMF also definitely includes an extended presence of artificial intelligence and machine learning. This technology is already at our door to support the TMF processes. I already saw some of it for document coding, recognizing the correct classification for the records that are entering the TMF. And maybe in a very near future, the AI will even be able to perform part of the quality review or the quality control on the document itself. So this is all very exciting.
Yes, it is. So this brings an end to our episodes today. Thank you so much for being here.
Thank you so much, Valerie. I was glad to be here.
As we conclude another illuminating episode of Face Forward, we find ourselves at the crossroads of science and progress. Remember that behind the jargon and statistics lie stories of unwavering commitment, meticulous observation, and the pursuit of evidence that shapes our understanding of health and disease. Stay at the forefront of knowledge and innovation and follow Face Forward on your preferred platform. My name is Valerie Kovney. Thank you for joining us. Until next time.